Hello, and welcome back to our channel. In this video, we will be discussing how to properly prevent and treat ankle injuries and get you back to your normal activities as soon as possible. Before we get into today's video, be sure to hit that subscribe button down below. We post daily videos and aim to educate our audience on the world of sports medicine. First, let's discuss a couple key ways to help prevent ankle injuries. Number 1 is strengthening exercises. Strengthening exercises can help to improve the stability of the ankle joint, making it less susceptible to sprains. This can include exercises such as calf raises, ankle dorsiflexion, and balance exercises. These exercises focus on strengthening the muscles that support the ankle joint, such as the gastrocnemius, soleus, and tibialis muscles. By strengthening these muscles, the ankle joint will have better support and be less likely to roll or twist, which are the main causes of ankle sprains. Number 2 is stretching exercises. Stretching exercises can help to improve the flexibility of the muscles and tendons surrounding the ankle joint, which can reduce the risk of sprains. This can include exercises such as calf stretches, ankle stretches, and hamstring stretches. By stretching the muscles and tendons, the ankle joint will have a better range of motion and be less likely to be injured. Number 3 is wearing proper footwear. Wearing shoes that provide adequate support and cushioning can help to protect the ankle joint from sprains. It is also important to avoid wearing shoes with high heels, as they can cause instability in the ankle joint. Proper shoes can provide the right arch support, heel stability, and cushioning that the foot needs, which in turn can prevent sprains. Number 4 is avoiding uneven surfaces. It is important to avoid walking or running on uneven surfaces, such as gravel or grass, as these surfaces can cause the ankle joint to twist or roll, increasing the risk of sprains. By avoiding uneven surfaces, the ankle joint will be less likely to be twisted or rolled, which in turn will reduce the risk of sprains. Number 5 is proprioception exercises. Proprioception exercises help in developing your sense of balance and body positioning, which can help to improve the stability of the ankle joint. This can include exercises such as single-leg balancing exercises and wobble boards. By doing proprioception exercises, the ankle joint will be better able to react to unexpected movements and be less likely to be injured. Now let's discuss the best ways to treat an ankle injury. The first step in treating an ankle injury is the Rice method. The Rice method, or rest, ice, compression, and elevation, is a widely accepted method of treating an ankle sprain. This involves resting the affected ankle, applying ice to reduce swelling, wrapping the ankle with a compression bandage, and elevating the ankle to reduce blood flow to the area. The Rice method is a first aid treatment that should be applied as soon as possible after the injury to minimize the swelling and pain, and to improve the healing process. Once the acute phase of the injury is done, we can move to physical therapy. Physical therapy can help to improve the strength, flexibility, and range of motion of the ankle joint. This can include exercises such as stretching, strengthening, and proprioception exercises. Physical therapy can also help to reduce pain, inflammation, and the risk of re-injury. Physical therapy can be started once the acute phase of the injury is over, usually after 2 to 3 days of Rice. A physiotherapist can assess the injury and create an individualized treatment plan to help the patient regain their normal function. Medications and over-the-counter pain relievers such as ibuprofen or acetaminophen can help to reduce pain and inflammation associated with an ankle sprain. Medications can be taken as needed to control pain and inflammation, following the instructions on the package. Wearing a brace or taping the ankle can help to provide support and stability to the ankle joint, which can help to reduce pain and prevent re-injury. Bracing or taping can be used to stabilize the ankle and to reduce the risk of re-injuring the ankle during the healing process, which can be started after the acute phase of the injury and under the guidance of a physiotherapist or an orthopedic doctor. In severe cases, surgery may be required to repair a torn ligament or other damage to the ankle joint. Surgery is usually considered in cases where the injury is severe and the patient has not responded to conservative treatment. Surgery is a last resort and should be done under the guidance of an orthopedic doctor. It's important to note that the treatment approach may vary depending on the severity of the sprain, and it is best to consult a doctor or a physiotherapist to get an accurate diagnosis and appropriate treatment. They can also monitor your progress and make adjustments as needed. It is important to follow the treatment plan and to be patient as healing can take time, and the goal is to regain full function of the ankle and prevent re-injury. So there you have it. Ankle sprains 101 and how to prevent and treat them. Remember, injuries are an unfortunate part of the game, but with the right knowledge and preventative measures, you can reduce your recovery time and get back in the game faster. Thanks for watching, and we'll see you next time.